So this is the gastroc. What we can see on the left-hand side is we can see that there's a nice white line in the fascial interface of the gastroc. But looking at the right-hand side, what we see is we see a separation between that white fascial line and the actual muscle. So what's happened here is this is a partial gastrocnemius tear. So we just want to make sure that we're aware of how these look on diagnostic ultrasound. I'm going to provide a lot of resource for this as well because this is a very different concept. And then the other thing to note here is the picture says mid-calf long. What that long refers to is a long axis as opposed to short axis. And I'll go over what those terms mean on the live Blackboard Collaborate session. So what we're going to see here, these are the big characteristics of tissues. So muscle typically is hypoechoic. It shows up just a little darker than the other surrounding tissue. Cortical bone is going to be hyperechoic. It's going to show bright white, as we've seen in other slides. Subcortical bone is going to be either hypo or anechoic. Typically it's anechoic. And tendons are going to show up a little brighter. Tendons are a little thicker tissue, a little more dense tissue, and they're going to reflect much more of the ultrasound wave than, say, like muscle or subcutaneous fat. So the characteristics of ligaments, we want to make sure that we understand what a ligament's going to look like. Ligament's going to be a little hyperechoic, but this is really where you have to know your anatomy. You have to know where that ligament normally lies. You have to know where the bursa, for example, in the bottom slides normally lie, how those are going to look on all of our imaging, including diagnostic ultrasound. So what we want to make sure here is we know how those images look, because what we don't want to do is we don't want to misdiagnose somebody with a tear, as you can see in that bottom slide, when really we're just looking at a bursa. So just really be aware of how all these tissues look. Like I said, we're going to do a lot of study on this because I want to make sure you guys are comfortable with this because it's something you really can use in the clinic. So here's the characteristics of tissues again. Hyaline cartilage is going to be dark. It's going to be hypoechoic. As we can see in the top slide, that hyaline cartilage is lying right next to the bone interface. Nerve tissue, again, is going to be a little darker than tendon. So for things like measuring the median nerve and ultrasounding the median nerve, we definitely can do those things, but we have to understand where's the tendon, where's the nerve in relationship to the tendon, what are we looking at, what are we not looking at, because if you get confused, we obviously can misdiagnose something. So we want to make sure we have a very deep understanding of how our anatomy looks, not only in the traditional sense, but also from a superficial to deep sense as well. So definitely make sure that you practice this a lot before you actually use it in the clinic. So here's some abnormal findings. What we're going to see with a muscle strain or muscle tear, as you can see, is there's a dark area that has a widening to it. Okay, so what we see here is we see that there's actual disruption in the fascial layer in the muscle. So we definitely want to make sure that we're viewing those sorts of things. It's easiest to practice this with someone that you know has a muscle tear because we can definitely then view it and say, oh, well, that's what a muscle tear looks like. Looking at the bottom slide, a muscle fibrosis, and this is really interesting because we can actually see calcification in the actual muscle tissue. This is going to show up obviously a little hyperechoic. It's going to show up a little brighter because obviously there's an increase in calcium within the muscle tissue itself. Taking a look at some other abnormal findings, what we see here is long head of the biceps, and we see it a normal versus an abnormal. Look at all that swelling surrounding that biceps tendon. So that's going to give us a really good sense. And that ultrasound honestly is taken right at the anterior interface of the shoulder. So something we can very easily do in the clinic that's very non-invasive. Now taking a look at the bottom slide, take a look at that tendon tear. Okay, so what we see is we can actually see on the left-hand side a normal tendon versus an abnormal tendon. And you can see how that tendon lacks continuity. There's a line of brightness or a line of hypoechogenicity. And then what we see is we see a big dark spot in the middle. That dark spot is going to be the tear. This is a rib fracture. So I always find this slide really interesting because not only does it show you that we can view things like a rib fracture with diagnostic ultrasound, but we can also see how that rib fracture not only is so painful, because I've had rib fractures in my life and they hurt a lot, but we also see how it is piercing into the overlying muscle. So it's really interesting to note these things because we really can get a good sense of what our patient's going through with this sort of interface. Now, obviously, with the other imaging modalities we've looked at, like MRI, CT scan, X-ray, we're definitely not getting a picture like this with those other modalities. Take a look at this. This is a supraspinatus tear. What I want you to do is I want you to pause the slide and I want you to try to identify where that tear is. I want you to try to find a normal supraspinatus tendon via ultrasound on, say, like a Google or Medscape or another program, and really try to identify where that tear is. This is going to be very important to know not only for the context of this course, but definitely clinically, because these are something that we can really have a good impact on as physical therapists. You know, the example is, hey, my patient comes in, I fell down, I think I may have torn my rotator cuff. You can do an ultrasound really fast, and you can get a good sense, at least at the supraspinatus, if they potentially have a tear and need further intervention. Now, taking a look at this, now what we're looking at here is another supraspinatus tear. So we can definitely see where the deltoid muscle is versus where the supraspinatus tendon is. We also can definitely see where that tear is happening. So we actually can see a full tear. Well, this is a partial tear, I should say. This is a partial tear of the supraspinatus, but you definitely get a good sense of how this is happening. And you know, the big advantage here is, like I said, no radiation, no MRI, don't have to spend a bunch of money on this. It's something that we can perform very easily in the clinic. So here's another rotator cuff tear. And if you guys aren't catching the theme, I really like rotator cuff tears with ultrasound imaging. So another image of a rotator cuff tear, definitely look at what areas are hyperechoic, what areas are hypoechoic, and be very comfortable with how this image looks, because these are images that we're definitely going to see on final examination for the context of this course. We're also going to see these obviously clinically as well. Now, this is a Baker cyst. Obviously, Baker cyst is going to happen in the popliteal fossa. And this one's a very interesting one because, and I find this interesting, especially in the context of PT. And what I may do is I may do this on the Blackboard Collaborate session, is dry needle some of that area. So what we see here is we see a needle entering a Baker cyst. Now this is a hypodermic needle. What they're going to do is they're actually going to drain it, but give you a good sense of an ultrasound guided injection or an ultrasound guided aspiration. These are really nice because we can accurately tell, okay, I'm in that cyst, and I can effectively drain it as opposed to draining other tissues around it. So there's an MCL tear. So definitely make sure that we understand, and this is a good comparison because this shows you an MCL tear on an MRI and then how it's going to look on an ultrasound. So you definitely can see where that white line is supposed to be as opposed to where it is. So we can see a significant tear happening in the mid-substance of the MCL here, definitely using ultrasound. So taking a look at patellar tendonitis here, what we really see is on MRI, we can see some swelling, we can see some damage happening at the patellar tendon, but we definitely can see a lot of that swelling happening in an ultrasound as well. So you take a look at the quote normal tendon and you have a nice thin line of a hypoechoic space. And then when the swelling happens, so look how wide that area of the hypoechoic space happens. So what that really shows us is that really shows us how swollen that patellar tendon can be. But again, we can get a nice picture here using ultrasound without any sort of ionizing radiation and a lot quicker and cheaper access point for our patients. Now here's a patellar tendon rupture. Now obviously a normal patellar tendon is going to look at what we see on the left hand side of the screen. We see a nice white line that is hyperechoic. On the left side, it looks like a mess. You know, we can see a lot of disruption happening mid-substance of the tissue there. So again, this is that patient that comes in, I fell down, holy cow, I think I maybe have messed up my knee. Let's fire up the ultrasound and let's take a look at it. But again, really got to know your anatomy here, really have to know what you're looking at here. But I will tell you, with some practice, we as physical therapists are very well equipped to perform these sorts of images. Now take a look at this. What we have here is an Achilles tendon. Now a couple things on here. We see a ruptured portion of the tendon, and then we actually see a hemorrhage. Now I will tell you that this individual, very well skilled with looking at ultrasound, I would need some practice to really diagnose this one. But it's one of those things where I think with a lot of practice, I think with a lot of continuing education, and just a really good in-depth knowledge of anatomy, we can get pretty good at this. Now taking a look at this is a Doppler ultrasound. Now what we see here is we're going to have a little bit of colorization. What that colorization is really looking at is the amount of blood flow that's flowing through that area. So what we can see obviously in the upper right hand corner of the screen is we see an area where the vein should be, and then we can see a very large clot or deep vein thrombosis happening. The other thing is we can use ultrasound to detect what's called neovascularization, and a lot of times that can diagnose like a chronic tendinopathy, because we're actually going to have more blood trying to get to that area because obviously it's trying to heal. So that's more of a specialized ultrasound, I will say, so it's not something that we're going to be good at as novices. So here's a nice little chart, advantages and disadvantages of ultrasound relative to MRI. These are the big things. So make sure you know a chart like this. Make sure we know where we're going to have advantages to use ultrasound, but also really be aware of limitation. I don't want you guys to get the sense of, hey, ultrasound is the greatest image modality in the world, and I'm going to go out and buy one, and I'm going to cure all my patients with it, because that's just not the case. As you guys can see, this is a difficult image modality to use. There's a lot of operator error here. There's a lot of skill that has to be involved if you're going to do it accurately and to the best of your abilities. So definitely make sure you understand the advantages and disadvantages of ultrasound. So taking a look at medial meniscus tears here, this is a nice little chart, if you will. So what we see here is how an ultrasound performs against an MRI for a medial meniscus tear. What we can see is for sensitivity for an under 30-year-old, so for example, that high school, college athlete, maybe they're just out of college, or maybe they're obviously below 30 years old, sensitivity is pretty darn good, specificity is pretty darn good as well. Even over 30, it's not as good, but it's still pretty good. So, the takeaway message here is that I can accurately diagnose a medial meniscus tear, or at least screen for other imaging. So, like I said, we're going to do a Blackboard Collaborate session live. We're going to use the ultrasound machine live, and hopefully this is a good sense of how your day is going. Hope your day is going better than this. I will say, if you're going to use CT scan or MRI, don't use a metal bed, because this obviously will happen. Other than that, everyone, have a very, very good day, and I will see everybody virtually live later.